Hi everyone, I'm Heather Wen, a retired nurse practitioner and the founder and practitioner at Arizona Healing Alternatives. On this channel, you'll find several videos, what I like to call aha moments, where we'll be discussing issues that impact your health. So whether you decide to use Western medicine, alternative medicine, or even a mix of both, I'm passionate about you knowing what your options are. For today's aha moment, I'm going to give you a little technique. There's actually two little techniques that you can do to try to help if you have really mild cases of kind of thoughts that are ruminating, that keep thinking about things, or almost very mild obsessive compulsive sort of behaviors where you have to keep doing the same thing sort of over and over again. And so stay tuned and I'll give you a few little tips on how to help with those things. So obviously, if this is a really serious case of an OCD or obsessive compulsive disorder or ruminating or intrusive thoughts, this technique most likely is not going to help with that. But if you're already getting help, and I would encourage you to, if you have really severe ruminating thoughts, meaning you can't stop thinking certain thoughts, or negative thinking, or this sort of thing, or things that keep you up at night, or obsessive compulsive disorder types of behavior, such as you have to touch the doorknob a certain number of times, or check the house to make sure everything's locked, or checking over and over, and sort of these compulsive disorder things, please seek out help. So with that, when you seek out help, it could be a counselor, it could be a psychiatrist, it could be a psychologist, but it could actually be medications that are needed, Western medications that are needed to help with those sorts of thoughts. It just means that the brain is not kind of lining up and sending signals the way we'd like it to, and sometimes you need help or even medications to fix that. And an important disclaimer here is I'm not talking about the sort of intrusive thoughts or ruminating thoughts where it's just about, oh, did I leave the stove on? Or, oh, oh my gosh, thinking various different things, or ruminating or worrying about things, because that'll be another video altogether when we talk about worry. But when it comes down to it, I'm talking about just those basic things. But if you're having thoughts such as wanting to hurt yourself, wanting to hurt someone else, those are 911 emergency calls where you need to get help immediately and not wait for an appointment with a mental health professional. Those are not okay ever to be thinking thoughts like that, and you do need to seek out professional help if something like that happens. But if it's not a severe case, what about cases where you are just thinking things and you're trying to think more positive, but the negative thoughts keep coming in? Or I know for myself, when I was growing up, there were issues that were going on where somebody else was having a problem, and so they would have sort of obsessive compulsive things about how they wanted the house done or what they wanted. And so it sort of passed on to me that when I'm feeling stressed, that can't remember if I locked the door, or I can't remember if I did that. Now, I'm very fortunate that it was very mild, but what would happen is I'd get out to the car and I'm like, oh no, I forgot to do this. Oh, did I turn the stove off? Oh, did I do that? And so by the time I got out the door, it's about 10 minutes later. So a wonderful counselor taught me some things that you can do with that. There's two things that are really important. First of all, there's a thought stopping technique. So the thought stopping is, and I do this in my practice to help patients too, is if you start having those thoughts or negative thinking about things, it's to picture that stop sign. Now, some people are really visual and some people feel stuff, but it is to, if you can, remember a time when you've seen a stop sign, or visualize a stop sign, or feel that a stop sign is there, and some people see the red on it, and to stop those thoughts and just stop. And then when you stop that, then replace it with another thought that's better. Okay, so that's a really easy way of doing it. It's called a thought stopping technique, and it just kind of try to stop that cold. The second thing that you can do is so for example, and it's such a great indicator, the way I know that I'm really stressed about something is when these behaviors come back. So then I know I'm not present in the moment when it's happening, because I'm so distracted thinking a bunch of other things that I can't remember whether I locked the door, I can't remember where I turned off the stove, or I can't remember if I left the refrigerator door open, right? And so these days refrigerator doors have little bells on them and other things like that. But even still, what can happen is maybe it's not open enough for the bell to go off, who knows? But when it comes right down to it, what I'll do is I'll allow myself to do that once. So when I go out, I'm like, oh, okay, did I turn that off? Did I turn the stove off? Did I check the lock? Whatever it is. And then what I'll do is I'll become more present, getting kind of what goes on here, more present and focused in the moment. So instead of rushing around, oh my God, I gotta get out of the house, I gotta get to work, I gotta go here, I gotta do there, I'll slow myself down and go, okay, this means I'm stressed and I need to be present in the moment. And then I'll allow myself to go back once. And I'll go back once, I may check stuff once, and then I put a mental picture in my head of that it's been done. So it's been done, that's the picture in my head, I'm present, I'm focused in the moment, and then I leave and allow that once. So those are two little things and little tricks to try to see if that helps. Obviously, if it doesn't help, if those two techniques don't work for you, then definitely please seek out some help, because there are lots of counselors, life coaches, psychiatrists, psychologists, all sorts of different things that can help. And what I do, we go after it and reprogram it a bit. Sometimes emotional reprogramming is necessary, sometimes hypnosis is necessary, but also it can just be just passing on what I passed on to people, and many times that can be very helpful. But what it all comes down to, if it's very mild, and for me specifically, was about living in the moment, getting out of the stress, even doing, and I'll put the link to it up here, that emotional overwhelm technique, or what I call de-stressing in a minute, where you put your fingers up here and just kind of calming the nervous system down to stay in the moment, to know what's going on, because for me it's a really good signal as to how stressed I am that day. I hope this has been helpful to you. Thank you so much for listening. Please don't hesitate to write comments in the comment section and like this video if you liked it. Thank you again. I hope this helps. Have a great day.